right, today we're going to get into something pretty fascinating, a genetic condition called Cleidocranial Dysplasia. So let's start with a kind of wild question. I want you to just imagine for a second, what if you could bring your shoulders all the way together, right in front of your chest, so they're actually touching? I mean, it sounds like something out of a comic book, right? A superpower, maybe? Well, believe it or not, for people with a condition called Cleidocranial Dysplasia, or CCD for short, that incredible mobility is totally real. So what is CCD? It's a genetic disease that affects the bones, and it mostly has to do with how the skull and the clavicles, your collarbones, develop. So you might be wondering, where does it come from? How do you get it? Well, it's what's known as an autosomal dominant disease. Now, that sounds super technical, I know, but all it really means is that you only need to get the gene from one parent to have the condition. Just one. Okay, so we've got the what and the how it's passed down. But what does this condition actually look like? What are the key physical signs? Let's dive into that. So, starting with the head and face, there are a few really distinct things you might notice. People with CCD often have a larger head with something called frontal bossing. That's just a fancy way of saying a prominent forehead. You might also see ocular hypertelorism, which, again, sounds complicated, but just means the eyes are spaced a bit wider apart. Then there's a hypoplastic mid-face, meaning the middle part of the face is underdeveloped. And if you look inside the mouth, a high-arched palate is pretty common too. And it's not just the face. Looking at the rest of the skeleton, a shorter stature is common. And of course, there's that amazing shoulder mobility we talked about at the very beginning. The reason for that? It's all because the collarbones are underdeveloped, or sometimes they're not even there at all. The dental signs are a really big part of this too. Baby teeth tend to stick around for way longer than usual, and the permanent teeth can have trouble coming in. It's even common to have supernumerary teeth. Yep, that means extra teeth. Okay, with all these unique signs, the big question is, what about treatment? And this is where the story gets really interesting. Because when it comes to managing CCD, it's like a tale of two completely different approaches, depending on which part of the body we're talking about. And here's that contrast, laid out side by side. It's really striking. For the bone anomalies, so the shape of the skull, the missing or small collarbones, there's basically no treatment. These are just characteristics of the condition that people live with. But then you look at the dental issues, and it's a completely different story. There's a whole multi-step game plan. Things like surgery to help those unerupted teeth come out, a lot of orthodontic work, sometimes even major jaw surgery, and using prostheses. It's a very active approach. But wait, there's more. The story of CCD doesn't stop there. It turns out there's a connection to another condition, and this one has a really memorable rule of thumb when it comes to surgery. In that connected condition, it's cleft palate. Yeah, it turns out that there's a higher chance of having a cleft palate if you have CCD. And when surgeons are getting ready to repair a related issue, a cleft lip, they often use this very specific guideline to get the timing just right. And that guideline is famously called the Rule of Tens. It's a classic in the medical world, really. It's basically a simple checklist to make sure a baby is healthy and strong enough to handle the surgery. So, what's in this Rule of Tens? It's a super straightforward 3-part safety check. Ready? Number 1. The baby has to be at least 10 weeks old. Number 2, they have to weigh at least 10 pounds. And number 3, their hemoglobin has to be at least 10 grams per deciliter. See? All tens. It's a simple but really effective way to make sure everything goes as smoothly as possible. And all of this really brings us to a bigger, more thoughtful question to end on. When you look at a condition like cleidocranial dysplasia, you see this really clear line, right? There's what we can treat, like all those complex dental issues, and then there's what we can't, the fundamental skeletal structure. And that makes you think, doesn't it? How does knowing the limits of our treatments change what it even means to live with and manage a genetic condition? Definitely something to chew on. Thanks for digging into this with me today.